back in the days, you remember the way we looked at the pelvic floor was typically postpartum issues was always a weak pelvic floor. Pain with sex was usually a high tone or a tight pelvic floor. There was no overlap. And what we're kind of understanding a lot more now is a lot of postpartum injuries, stress urinary incontinence, even pelvic organ prolapse symptoms, that it actually is a little bit more high tone. And my theory is during that time that you were doing those sports and active, figure skater, dancer, gymnast, all those sorts of things, you're so active that you are maintaining stability strategies and strength strategies through that movement spectrum. As we get older and we're not participating in those sports anymore, your brain's looking for a replacement there. If we're not staying active, your brain's like, all right, well, how do I maintain that stability if I do have this genetic hypermobility? You're an adult, you have these adapted strategies that you don't think anything of because you've been that way your whole life, but does that set you up for other issues? And sometimes I think it's obvious, painful sex, but I think there's other things that are less obvious that people don't necessarily put together, like urgency, frequency, constipation, hemorrhoids.
Hi and welcome. It's Jessica Drummond here from the Integrative Women's Health Institute, and I am here with Dr. Carrie Pagliano. She is a physical therapist that is specialized in working with postpartum moms, getting them back to fitness and in particular running. So Carrie, welcome. And let's dive into why you started focusing your practice in this population.
Yeah, thanks for having me, Jess. It wasn't the plan. Let's put it that way. I've always been a runner my entire life, like back to like seventh grade. And, we all go into physical therapy because we want to help people. And I got really lucky being put in the right place at the right time, going into pelvic health. At the same time, I was also doing a lot of orthopedics. And, this is 20 some odd years ago where they were very separate. And lo and behold, years later, we mash them up together. We get a lot further. And we also have a lot more women and moms being active, including myself, after having kids. And so I think that personal interest and that professional need happened to collide at the same time. And then now, more recently, in the last, I would say 5 to 7 years, we've got a lot more research focused on that. So it's a really, really fun time to be in that space. And it's always fun to study and learn about things that you do yourself. So I got super lucky in that respect.
Tell us a little bit more about your story or any client-patient stories that really deepened your perspective or changed how you were thinking about these two issues of running and being postpartum.
Yeah, I think historically, you kind of have to look back and understand not only how we used to look at these issues as professionals, but also as moms trying to navigate what was going on. So backtrack, 15, 20 years ago, we would just say, well, just run and see how it goes. Mm-hmm. And we didn't really have a lot of guidance or ways to screen out injuries. And even if we did, we didn't really have a good understanding of why somebody had leakage versus another patient, or why somebody was experiencing prolapse symptoms, but they didn't necessarily have any anatomical prolapse and so we didn't understand as much as we understand now. And then same thing with running, to be honest. So we had these two kind of parallel paths. And alongside, we've got a third path where we have women just, starting to be more active. And so myself, I ran, recreationally through college, after PT school, that sort of thing. I had actually hip surgery in, I think it was 2007 for femoral acetabular impingement and a labral tear, which that was really new back then. And then went on to have my oldest son. He is, he's almost 14, which is insane. So he was born in 2011. So really that period of time, I was trying to get back to running after hip surgery. Didn't really get that far because, again, we didn't have great rehab. And then trying to get back after having a baby, because you're supposed to bounce back. That was still the thing back then. And the problem that I found is there really wasn't any guidance on how to do that. And here I was, this person that supposedly had this background in orthopedics and this person that had this background in pelvic health. And if I didn't know what to do, how was anybody else going to figure it out? And so that's around the same time that kind of this mashup of looking at the whole body really, I think, started to become real, and to understand the role of the whole body beyond just the pelvic floor in leakage with activity and impact with, prolapse symptoms. And ironically, after my second in 2013, I had stress urinary incontinence. I had, prolapse symptoms and was navigating abdominal separation or diastasis recti. And again, like, if this is what's going on with me and, I'm supposed to know all this stuff, what's the path forward? And I kind of had two choices. It was either give up what I love to do because that's all the information we had, or look for a new path and see if I can figure it out. And wasn't interested in giving up running. And so when there's a will, there's a way. And so fortunately, I wasn't the only one kind of looking at this path and kind of looking at that mashup. And so fast forward to now, we have so much more people that are, women in research that are looking to answer the questions of like, what actually happens in normals in women with their pelvic floor, and then what changes, during pregnancy, what changes in postpartum, but then also this parallel path in the orthopedics of how does our body mechanics change when we run in pregnancy? How does that carry over into postpartum? How should that guide what we do as far as getting people back to activity? And how does that give us some insight in how to navigate some of these pelvic floor issues that keep women from being active? So it was one of those things where I wasn't willing to accept no, I'm not good at that. So
Yeah. Yeah. So now say a client comes to you who they're past the really acute phase, but maybe 5 months postpartum, wanting to get back to, I would say, like strong recreational running. Like she wants to be able to run in road races in her town. And she has, a 5-month-old. She's given birth relatively recently, and she is noticing a little bit of leakage. And she might have even had it pre-pregnancy, but sort of ignored it then. But now it's becoming difficult to ignore. Where do you begin?
So with everybody, I like to kind of lay things out across the lifespan, because I think that assumption that all this stuff happened because you gave birth isn't necessarily accurate. And so the example you gave, maybe she had a little leakage before she was pregnant. That to me, I want to know what sports people did growing up. I want to know, did they have any issues with constipation or hemorrhoids or leakage, like you mentioned? Because then we're looking back and saying, are there any genetic predispositions? Are we concerned about hypermobility, Ehlers-Danlos? Like, it gives me an understanding of what their muscle strategy was and activity prior to even the increase in hormones that comes with pregnancy. I want to understand how the pregnancy was. Were there any musculoskeletal issues, with back pain, SI, pubic bone pain? Were they able to maintain activity? And just a piece of it is that delivery. And, what happened there. I mean, personally, with my oldest, it was a 3-day induction that unfortunately ended in a C-section that was unplanned, but you can still have pelvic floor issues with C-sections. That's the other thing people don't realize either. And so we're taking all these pieces, and then what did that early postpartum look like? Were you able to get out walking? Were you able to get sleep? What did your nutrition look like? What did stress look like? Is your baby, having feeding issues? Any issues with postpartum depression? We know all this stuff plays a role in our ability to be consistent with activity. And you can't tell what tolerance is until you're consistent. And then from there, did you have any help? Did you, see a pelvic floor physical therapist within the first couple weeks afterwards? Or did you just DIY, start running at 6 weeks? You're not doing any strengthening, that sort of thing. So I'm trying to get initially, what are we walking into? And where might be the quickest opportunities for change? Because as you know, as a mom, the goal is how little do we need to do so no one dies? We need to I need quick wins.
Yeah.
Because I think if we have barriers up of these very dramatic, over detailed sort of processes that require too much time, it's not an actionable path forward. So where is the likely problem? Is it, a pelvic floor issue? Are we talking, I talk about it kind of like a a recipe for a soup. Like, what are all the ingredients and how much of what? And what are the ones that we kind of have to pay attention to the most? And what are the easiest wins? And if we start to kind of go about it in that very intentional way, with the goal that if you are going to go back to running, we need to have a regular strength program. And a lot of runners don't because they just want to run, but it's imperative. And then we need to have an impact program too, which again, everybody dropped back in high school when they stopped doing their, their drills and things like that. We need to get back into that. And the good news with all of this is if we get all that set in place and we get on top of symptoms, we address any hormone issues, if they're lactating, all this stuff that we learn in postpartum, we're going to take that forward into perimenopause when we need to be concerned about bone health and tendon health and changing estrogen again. So I kind of present it in a way that we're not just learning it for this moment. This is you're understanding how you got to this point, but we're going to carry this forward to allow you to be active and very, very long term.
So ideally, when would you see any active postpartum woman, like pre-pregnancy, because I think one of the things that happens in our sort of not polarized, but categorized or, divided health system is that any active woman who is going to be pregnant and postpartum is going to have these hormonal changes, just like every woman, if they lived long enough, are going to go through perimenopause. Every woman who's pregnant or postpartum is going to have these hormonal changes. And, assuming we want women to stay active and exercising and strength training and running if they enjoy it and all of these things, how are you sort of reaching this population as much as possible?
Yeah. I mean, the earlier, the better to have these conversations. For better or worse, I live in the DC metro area and we pride ourselves on being overeducated about everything, which is good news, bad news when it comes to kids because they're unpredictable and you can't plan for everything. But I have moms that even reach out when they're considering conception. Because there's things, again, that we can do. And again, if we know in advance there's issues with high tone or non-relaxing pelvic floor, we know that there's issues, with painful sex or things like that, we can start having those conversations on how to lay this process out. Now, if somebody is pregnant, usually we'll see them after we know that pregnancy is viable. Obviously, we can see them before for any musculoskeletal issues like SI pain or things like that can happen with the hormone flux. But we start having those conversations as early as possible, even if they're not having issues, just to educate them. Because as many of us have seen, we see them in postpartum for the first time and they're like, oh, well, I couldn't be as active because I had symphysis pubis pain or pubic bone pain, or, I stopped running because of sacroiliac or back pain, those sorts of things. And those things are really easily addressable during pregnancy. And some of the things that we're trying to kind of look at is if we address those issues, is there an impact on potentially reducing likelihood for birth injuries? Is there an influence there on high tone or non-relaxing pelvic floor? Can we teach down training better? Can we have an impact on the front end and not be reactive? So to your point, I think historically we've always been known as the fixers, and it would be really, really nice if we could do more prevention and education on the front end and be very, very proactive. And again, we can't control everything, but can we highlight where there's potential risks or things that we might want to pull in a postpartum or pregnancy doula or something like that for more support? I love doing that because again, like it's a lot easier to navigate those pieces and there's a lot less trauma involved than when you're, trying to heal injuries, you're trying to figure out how to be a parent for the first time, sleepless nights, those sorts of things. That's just hard. So if we can do it on the front end when people are a little bit more of sound mind and body, it's a lot easier for everybody.
Yeah. And what you said earlier about hypermobility, I think is so important and really underaddressed. And, I don't know if I'm seeing this more or more aware of it, but I think that a lot of people think if you are hypermobile, let's say you grew up as you were kind of naturally drawn to things like dance and maybe even swimming maybe even running because of like the tall, thin build as going to be a most successful high school runner, let's say. There's a myth that your pelvic floor, that muscles aren't going to be tight, that everything is just loose. So talk a little bit about the interrelationship between hypermobility and myofascial tension.
Yeah. I think this is one of the concepts that has evolved and allowed me to look at how we treat athletes in a much better way. Back in the days, you remember the way we looked at the pelvic floor was typically postpartum issues was always a weak pelvic floor, and pain with sex was usually a high tone or a tight pelvic floor. And there was no overlap. And what we're kind of understanding a lot more now is a lot of postpartum injuries, stress urinary incontinence, even pelvic organ prolapse symptoms. We're noticing that it actually is a little bit more high tone. And so when we go back, like you said, this is a question I asked, I'm like, were you figure skater? Were you a dancer, gymnast, all those sorts of things? Because you're going to gravitate to where that skill set shines. That was not me. And my theory is, during that time that you were doing those sports and active, you're so active that you are maintaining stability strategies and strength strategies through that movement spectrum. Sometimes in a very, I think, efficient way, and sometimes not. I do think when there's more aesthetics to the sport or the activity, say ballet or gymnastics or things like that, where we're taught to suck things in and hold it in more for aesthetics as opposed to, movement efficiency. I think there's another layer to that. And then my thought is that as we get older and we're not participating in those sports anymore, your brain's looking for a replacement there. And if we're not staying active, your brain's like, all right, well, how do I maintain that stability if I do have this genetic hypermobility? And the thought is that the brain's like, all right, well, let's just hold here. Or these movement strategies that you learned in ballet class, when you were 3, 4, 5 years old, have carried on, throw in diet culture, all that other stuff where you're supposed to suck things in and hold it in. These things have been reinforced because they've been taught at such an early age. So the thought is that you're an adult, you have these adapted strategies that you don't think anything of because you've been that way your whole life. But does that set you up for other issues? And sometimes I think it's obvious. Painful sex, obviously, it's pretty obvious. But I think there's other things that are less obvious that people don't necessarily put together, like urgency, frequency, constipation, hemorrhoids, those sorts of things that are a little bit more normalized. And so, again, these are the questions that when somebody is pregnant, it's really easy to kind of pull that story together and be like, hey, you may not be having symptoms that made you come see me in the first place, but I do think you're at risk for this. I'm not going to necessarily change your genetics. I'm not between now and when you give birth, but what can we do to take the edge off? What strategies can we use to make that strategy that your brain's adopted more accommodating for what's to come and be supportive of it? And then on the other side of it, and this goes kind of full circle to where I started, there was a long time where a lot of physicians who worked with patients with pelvic pain are like, don't do strengthening. Strengthening makes your muscles tight, which I think everybody adopted that for a really long time, unless you're in that space. And I started doing CrossFit probably about 7, 8 years ago, and started to realize, because I would have clients that would come in, like, if we're going to try and relax those muscles, we need to give the brain an alternative. Because if it's this inefficient holding and we don't give it an option, you get those muscles to relax, it's going to go right back to what it did before. So what's the alternative? And the alternative is to actually provide some good strengthening throughout that range of motion. And so this idea that people with tight pelvic floors shouldn't be doing strengthening, I think that's completely untrue. Like, we need to give them some efficiency. We need to get that movement back that they had when they were kids, and get that strength back because they were using it. We just don't look at it that way. Going to dance class as an adult is very different than doing dance class as a kid. But how can we find ways to move that allow support for that genetic hypermobility?
And especially, I think, we do have a fairly strong audience of women's health and wellness professionals. So speaking a little bit extra nerdy here for a second, I think when we get to those deeper ranges of motion. So I think a couple things happen. You talked about you work with women through the lifespan, right?
Yep.
So you have girls who are going to ballet, going to gymnastics. They're strength training almost naturally by body weight,
Yep.
by movement patterns, by, skills, whatever. And whether they're doing it competitively or they're doing it for fun, it's still that full system, like stability, just because their brain is learning about holding their body in space before they even have so much estrogen. Then they have the added estrogen, but it's inconsistent initially in puberty. Then we have pregnancy, where you have both changes in estrogen and dramatic changes in progesterone,
Yep.
and your whole body is changed, right? You've gained weight, you've moved your center of gravity, and it happens sort of slowly and then sort of quickly at the end. And I think the other thing that happens when you think about lifespan, so then you get to postpartum, and physiologically you lose that estrogen support. You're in that kind of mini perimenopause, if you will. You're in a low estrogen state. You have other hormonal changes. You've also lost the stability of having something sort of pressing into your abdominal wall. But I think the other main thing that happens between postpartum and perimenopause is then you also have kids. So
just a small detour.
It's a small detour, but I think it's like we always kind of forget about that. Like, and even though you might have, even in pregnancy, even in even in your 20s and 30s or whatever, done strength training, gone to adult ballet classes, went to Pilates, like you might have done all these things that sort of accidentally kept you stable. You don't now, because, and then you sort of maybe pick one thing, running.
Yep.
Because other moms are running and pushing strollers, or it's easy to go out and put your shoes on and be out for half an hour. And, it's funny because I was never a runner when I was young. In PT school, I picked it up because, of course, everyone's competitively doing triathlons and whatever.
Yep.
So, and then I met my husband in a running club. He's a huge runner.
I saw that.
Yeah, he still loves running. He's been doing it same as you, like since he was a kid, little kid. I never loved it, but it was like very social for me, and it was fine. I would do the 5Ks and the 10Ks. And then after I had my kid, my oldest daughter, I started running 5Ks and 10Ks because it was the only time I was alone. I was like, I needed 30 to 60 minutes. I was happy I was slow because I'd be like,
it takes longer.
I was by myself for like an hour.
Yeah.
And especially the races. I was like, I'd be out there. There's no kids allowed. Like, you're not allowed to bring the stroller.
Yep.
So I think one of the things that's a really important piece of this puzzle here is what you're saying about people then shift to, because especially if they are natural runners, like my husband, to get him to strength train is such pulling teeth. Like, but he still races at like under a 7-minute pace. He's, 65 years old. He loves that, but it's not, you can tell it's starting to be not really good for him, right? Like he's a man, so he has a little more flexibility. He's not hypermobile, like all these things. But even now it's like, oh, my knee, oh, my hip, it's like, well, if you strength train. But I think for moms, one of the big important things is I think letting them know that while I think what you said at the beginning, while there is not as much time to do all the different kinds of training that you wanted to do, efficiently adding in a few things makes a huge difference to your long-term viability in any of these sports.
Yeah. And I think, again, I think this is a parallel path that we now understand in just running, period. If you look at the generation of moms that are ahead of us, that it was revolutionary for them just to run as moms. Strength training was not part of their training in their 20s. It was definitely not something that was the focus. And a lot of them now in their late 50s, early 60s are not running anymore. They're switching over to other things like gravel biking, and because they just can't anymore. They're burnout and they're injured.
Mm-hmm.
And I think we're going to see a shift. And I think you and I are kind of this middle. It's kind of like, typing and writing, like we do a little bit of both, right?
Right.
And so we're that generation that we understand the benefit of strength training now later on. And then as we're going into perimenopause, menopause, and strength training, meaning like lifting weights, but picking
Yeah.
up heavy things and putting them down. What we also understand now in the running literature is you're going to have better performance if you do resistance training. And there's even, there was a recent paper out looking at resistance training versus plyometric training and 5K time trial time. You're going to be faster with resistance training, even over plyometrics. And so now that we kind of have that parallel data, granted, a lot of it is male, but we're extrapolating. I think you have more runners that are running in their 20s. There's a popularization of strength training and running. And so, again, I think the sooner we can get generations like our kids to understand the benefits of strength training and normalize it, because I don't think it was normal for us to go to Gold's Gym and lift heavy in the corner with the dudes in their, tiny little tank tops. And their Arnold Schwarzenegger muscles. Like that was just the generation we grew up in.
Right.
But if we normalize women picking up barbells and it's normal, and that if you are going to have longevity in running, which now it's more socially acceptable that we should be able to try and do this, we need to do these other things as well. And so that's why I kind of preach. But again, it can be incredibly overwhelming as a mom to be like, oh my God, that's one more thing. So understanding, okay, what does that mean to do strength training? I'm like, that means I maybe give you 3 or 4 exercises that if you can get to twice a week, great. Or, if you're like me, I have a class that I go to twice a week that gets my, it's a CrossFit style class. I get my Olympic lifting in, and then there's a conditioner. I go and I bang it out before the kids get up and it's done. And I have a couple, running specific things that I do aside of that. Like, it's about efficiency. You don't have to do all the things all the time. But if you check a little bit on each box, what we understand now is if you strength train and kind of replace one of those extra runs with a strength session, that's going to mean you're faster. That's going to mean less likelihood of injury, improved bone health, and tendon health, all sorts of things. And so when you look at it that way and you make it really simple, I think it makes it more actionable for moms. But again, it's about getting that messaging and normalizing strength training even before the idea of becoming a mom crosses their mind. So my daughter, who's 11, she understands picking up heavy things. That's what moms do. And that's what I would love her to do that when she's ready. So it's these changes in societal expectations, and then also changes in our understanding on what supports a runner's health and longevity.
Well, and I think this is where in postpartum and kind of the space between postpartum and perimenopause,
Yeah.
we also want to be checking like cortisol levels, stress hormone, because I think the problem is modern motherhood is...
You could just put a period right there. The problem is modern motherhood, period.
Honestly, yes. And so if we look at that, and I think what you said about replacing one of the runs with a strength train is really important. Like the problem is that women are burned out, but it starts when they're like 9, 10, 11.
Mm-hmm.
And so we really have to look at cortisol before we even kind of adjust their training program, because we have to think about how physiologically burned out their systems are so that they're not actually creating things like cardiovascular disease in a relatively low estrogen state when they're doing this exercise sometimes to be healthy.
Yeah.
So I think that's another conversation that is really important in this phase.
Yeah. I mean, I feel like, it's kind of deja vu in the perimenopause space right now. I've been in it personally for about a year. And again, it feels like everybody's throwing expectations from every different direction. I'm like, this is what you should be eating, and this is how much you should be sleeping, and this is how much you should exercise. And again, like, just that list increases stress, And so again, it's taking a step back and being like, all right, what's the cost benefit ratio here? Like, what are the easiest things for me to do? Because you don't want management of this phase in life to be an additional stressor, like you said. But yeah, I mean, it's funny, we all do the comparison game, remembering our mothers at our own age and what they had to navigate and manage. And they're just very, very different expectations. And again, a lot of it is, I blame the, Sheryl Sandberg wrote it.
Oh, lean in.
Oh, lean in. I was like, that was a setup.
Well, and I think it's, yes, that
you can have it all. Yes. However.
Yeah, that was a core problem. But I think it's actually deeper than that in the sense
I'm
that,
sure it is.
One of the things I've been focusing a lot on with my clients, because I have a lot of clients now with chronic illness who are perimenopausal, and they're trying to figure out, like, is it long COVID? Is it perimenopause? Is it,
oh God, that's a fun differential diagnosis.
Right. Is it Ehlers-Danlos? Is it MCAS? Is it dysautonomia?
Because it all is the same presentation. And all are like similar things of postpartum too. So it literally just blurs one into the other.
Right. So I think we're now meeting women in their 30s who are sick. Mm-hmm. And I think it's important that we really state it that way, because they're being so gaslit. Mm-hmm. And they're like, run harder, lift more, eat more protein. Right. And like, the tricky part is that's also true. But here's the thing that I've been spending a whole lot of time in my practice is teaching women how to really rest.
Well, and again, like, what do they think rest is? What are their thoughts around rest? What did they grow up? Like, that was not in my household growing up. That was not part of my upbringing, And again, I think if you look at generations and how are we teaching our kids about the benefits of it? And we're not even talking sleep here. Like, we're talking just rest in general. And I think the average person doesn't necessarily truly understand what that looks like, and also understand that you need to dose that as well. That's a conversation I have frequently in the context of when moms are returning to activity, is they always, the rest is minimal. And then they just try and do more of what the activity is, which I think is a very symbolic representation of kind of what we're talking about. And I'm like, you can get further with really efficient work and also be cognizant of intentional rest. But again, I don't know that people understand what that truly means and how to truly implement that intentional rest. I mean, I'm going to ask you, how do you navigate that with people, what rest means to them and what maybe it should mean for them?
Well, I start with that acknowledgement that you just said, that like, we literally were not trained in this. Mm-mm. And then we start with, what are you doing now? What do you think and feel rest is? This is one of the reasons why I actually am really committed to using things like heart rate variability measurements and like that wearable data that we have, I think is so valuable. Yeah.
Yep.
So yeah, exactly. That, or my continuous glucose monitor. I've got some stories on that. But we don't really know this. Now, I'm lucky. So I'm 50 now. My mom is in her late 70s. And so I had a stay-at-home mom, but I had like a busy stay-at-home mom, like your stay-at-home mom who was, volunteering at school and taking, she had 3 kids, and my dad used to travel full time. But my mom always was a napper. And
oh, wow.
And she also is a person who naturally, or by design, I don't know, but she underreacts. Those 2 values that I kind of picked up by osmosis are where I think are the most important tools, because I've read hundreds of meditation books and, pain brain remodeling strategies and all this stuff. And it really boils down to be present and underreact. And so there's a couple things that we do. One is we get really clear on the woman's vision, because it matters what she actually wants to do versus what she's doing because you're supposed to, you know?
She thinks she should do. Yep.
And that, I think, is a really wake-up call in and of itself. It's like, what the heck am I doing? You know, I've had clients literally like quit their jobs, you know, move, sell all their stuff. Like, people really can dramatically change when you ask them that question. But then the second piece is, okay, let's say they generally like their life and they don't want to like throw it all in the and move to a cabin, right? Most people are like that, and that's fine. So that's where we start with that question you asked. What are you doing now for rest? And usually the answer is watching TV or scrolling. And the problem is that that's not actually neurologic rest. So one of my favorite examples is, I don't know, 2 years ago or something, I watched this documentary about a bunch of NFL quarterbacks. And so they get hit every weekend, like multiple car accidents, whatever. And then, but they have a very slow get back into the week.
Yep.
And it starts with things like literally hyperbaric and sleep, like lots of sleep and very little strength, a lot of mobility, stuff like that. And so ideally, you're not going to do this every single week, but it's the same kind of pattern. You know, you're not going to like destroy your body every single week and then try to heal it. But it's the same kind of pattern around. And here's where women struggle. And I think the thing that's the most important thing. What is absolutely relaxing, fun, you know, resting your brain? That's what they don't know how to do. And so we discover things like literally just sitting outside, or things like watercolor or coloring, like things that are they're not good at, you know, it's just messy. Sometimes journaling can be that kind of rest. Meditation, which is hard at first, but when people become even a little bit more skillful, it can be real brain rest. So I think you have to actually train it, because we've learned it even less than we've learned, you know, strength training and get out and exercise. It feels weird at a root level because, you know, we are, and certainly our kids are, and accelerating products of intense late stage capitalism, right?
Yeah.
So we were literally trained to be very, very productive.
Yeah. No, it's funny as you're talking, I'm thinking, you know, a lot of those examples, I mean, should rest be, you know, for the privileged. And I think about growing up, both my parents were teachers. My mom didn't go back to work until I was 7 or 8 or something after my little brother was born. And I grew up in a house. I'm not going to lie. The beginning was Little House on the Prairie. Like, my parents built my house.
Nice.
We went into our woods and we cut down the trees, and that's what heated our house. We had a huge garden for a long time. This is all before they decided to, you know, hit the road in the summer, and we traveled in our RV every summer when I was a kid after that. But I think about all of the things that needed doing. And one of the things that was a constant concern and worry for my parents was, you know, once it was spring, we had to make sure that there was enough wood in the shed so it could dry over. And this is like cords and cords of wood, like a lot of wood, over the summer, so that it could dry in season, so that we had it to get through the winters. And then back then in Western New York, you could have very cold, snowy winters. And I remember these are like days where you're going out and you're doing repetitive tasks. And as a kid, you don't want to be doing that. You'd rather be doing a lot of things. And I do very much remember now, like, you go out and be all pissed off. be like, I don't want to be here, typical kid, teenager.
Any 10-year-old, any 12-year-old.
No, and I've been thinking about this lately because I have a 13, soon to be 14-year-old son, and so it's like, how did I navigate this stage?
Yeah.
And I would start that way, but like the repetitiveness, and we would be out there with each other and outside, and the idea, my dad would cut a tree down. We'd say he'd buck it up with a chainsaw and, chop it up. And then we put everything in this big trailer. He'd take the tractor back down to the house. We'd have to take everything back out, stack it again. Like it's not, other than the chainsaw, you want to be very intentional when you're using a chainsaw.
Yeah. Of course.
Which I didn't. My dad cut himself once in the ankle and that was not good. No, but this very repetitive task in which you're surrounded by family, it was necessary to do. It was physical labor, but I remember by the time we all went back in the house to get showered up and cleaned up, and there was a sense of contentment and satisfaction for a lot of different reasons. And that to me is something that, when you are in a position where you don't necessarily have, the ability to do watercolors with this or that or whatever, the time or, resources, opportunities to be present in repetitive, kind of thoughtless sort of things, to be around people to, because again, I remember being very upset, but by the end, my mindset had shifted, which I think speaks a lot to, do we have repetitive things in our day that could become restful? And there's certain things I obviously don't stack wood anymore, but in Arlington, Virginia, but I definitely do the dishes and load the dishwasher, and just changing that mindset on, the kids, not putting their dishes in the dishwasher. And even last winter, our dishwasher was broken and couldn't be replaced for a month, and having to wash dishes. Just can you be intentional with those sorts of things? Is there an opportunity for, quote, rest within that? Is just a different way of looking at it. It doesn't necessarily have to be, this thing that requires so much privilege, I guess.
Agree. And I think this is where it gets complicated, and it has to be interjected into whatever the current client's life is.
Yeah, exactly.
But it's also very similar, though, to how we would add strength training or change our running program, in the sense that, literally in like the Buddhist culture, it's like chop wood, carry water.
Exactly.
Is meditation, right?
Yep.
So I think you're exactly right that what I think most modern mothers need, who are in kind of like a fast pace, they have a job, they're in front of a computer, they're in front of a phone, whatever, and they're juggling children and all the mental load, they actually need more neurologic rest.
Yep.
So it's not even so much physical rest, because physical movement can be meditative. So I think you're exactly right. It could be washing dishes, it could be cleaning, it could be, walking the dog. It's like, could you do some of those things? Where we start often is, can we just do some of those things without our phone?
Yeah. No, the other place that I find is such a great opportunity to just be aware of the impact of breathing patterns and tension patterns and things like that are transitions in our day. If you are in a very car-based society, the nice thing about turning on a car is if your external cue is, okay, I'm going to just take a minute and sit here and breathe before I turn the car on. Let's say you forgot that and turned the car on. Okay, here's opportunity number 2 after you turn the car on. So you've got 2 chances to get it.
Yeah.
And I those transitions, I know for me, when my kids were little, going from work and then walking to go pick them up, in that 5-minute walk from our house to school, I'd take the dog with me. Like, that was an opportunity for me to just switch hats, clear the air, because as you know, when you pick up kids from school activities, daycare, whatever, it's kind of like a live grenade that you don't know if it's going to go off. You don't, and even now with teenagers, like, they have their buffer time, but I don't know what's coming home. And holding space so that you can transition. You can kind of put that hat aside from work or whatever that may be, so that you can have that space for yourself for a second and then be able to prepare and receive whatever's coming next. I I think allowing and expecting the need to have that space, like you mentioned, like mentally, neurologically, I think that allows you to kind of keep that down during the day. So you're not trying to fix everything at the end of the day. And again, it's that multitasking thing that we're taught to be productive, like you mentioned earlier. I am a shitty mom if I'm trying to do work stuff and deal with kid stuff at the same time. And I'm not a great, provider when I'm trying to navigate kid stuff too. Unfortunately, I work mostly with moms, so they understand. It's nice when you work with an understanding group of people.
Yeah.
But again, like we're more efficient when we're kind of giving our brain space to do those sorts of things. So having those spaces in between can be incredibly helpful.
Yeah. So, boundaries of time, boundaries of saying yes to things, all of that. So wrapping up our conversation about getting these active moms back to their
Yep.
goals, sport, talk about some of the things that some PTs who maybe dabble in this space but haven't fully specialized in it might be missing as their other health providers as they're helping women get back and really not only improve, decreasing the risk of things like leaking and prolapse, but actually recovering while they're also able to run.
I feel like the first thing is to, and I was guilty of this when I was a younger therapist before I had kids, is if a mom didn't get to all the things that I gave her to do, that I'm like, well, you can't get better until you just do this. And that's just not true. And it's also actually adding to the problem. Part of how I kind of deliver services makes me unique is that I very much am aware that if at all possible, moms are they want to get better. And so if somebody comes in and they says, okay, well, I wasn't able to get to this stuff, instead of just saying, that's okay, next time, I'm like, all right, well, tell me why. What were the barriers this week? And this is where I turned James Clear Atomic Habits into a parenting book where it's like, I'm like, okay, do you have a place so that we make this super brainless for you? Because again, like moms want to do these things. They want to feel better. They want to do the right stuff. How can we set up the environment to be incredibly supportive of that? And we literally will go to, okay, what do you do the second you wake up? And 99% of the time, what the answer is. They roll over and they grab their phone because their alarm is on their phone. And literally one of the first things I'm like, okay, so why is your phone not downstairs in a different room? Like just get an alarm clock. Like, again, it goes back to kind of what you said earlier. Like if our first thing is our phones, and again, there's lovely things about them. I enjoy them. However, if that's our first go-to, you're already reactionary. And I feel like being a mom is so reactionary anyway. So I was like, can you put yourself first, go pee, because that needs to happen first, and then immediately go from there. If somebody's not awake yet, go to that mat that you set up. You're going to do these 3 exercises that are so stupid simple that you don't even need to look up the video. And then you also have a conversation with your partner the night before that if kid number 1, 2, 3, whatever, wakes up during that period of time, that is your time. They're going to go get them until you are finished. Or if that kid's a little bit older, that kid knows that, hey, you can come on over and do stuff with me, or you can grab your iPad or whatever that is, but I'm going to finish this. And then immediately go get your coffee or go get the kids, or like you're checking your box first. And so it's those logistics that you would think are very inherent to parenting, and they're not at all. And what we need to do, I forget what author said this, is like the night before, pretend you're your own assistant. Set yourself up to do the things that tomorrow you will thank you for. And that's where those I make fun of my father-in-law because he eats the same lunch every day. Reducing those decisions, again, if I get up and I do this automatically, and it's not even anything I have to think about, like that's consistency is 99% of the battle, you know? And so to go back to providers, are you setting up a supportive environment, or are you setting up an environment that's adding additional barriers to add to my mom guilt? And trust me, I'm doing a good job of that on my own. So like, it sounds so ridiculous. I never learned that in any PT school, any class, whatever. That's mom knowledge right there. So that's the first part. What can I do to support that consistency?
And that's health
And then
coaching. Literally, that's the skill set of
Yeah.
health coaching.
Yeah.
Yeah. It's a
I think
communication and barrier to change skill set. Like,
exactly.
why
But we
can't
don't
they do it?
realize that as health providers is like, we're inadvertently, we think, I will dictate, you will do as I say. I'm like, no, it has to be that collaboration.
Yeah.
Same thing with the exercises that we give people. The biggest complaint that I get, and I do a lot of second, third opinions all the time, is they go see somebody and they have this great motivation. And then that therapist gives them a set of exercises and then they add to it and then they add to it and they add to it. And eventually it's like the length of a CVS receipt, right?
Yes.
And as soon as I say that, everybody's like, oh, yeah, yeah. And they laugh, but they know it's true.
Yeah.
And I'm like, no. If I give you a couple of things with exercises, if I give you something that either doesn't make sense to you, you don't get to it, or you don't like it because you're not feeling any benefit from it, you need to tell me and we'll change it. And then once I give you a new one, assume the old one's gone. Like, I'm not going to give you any more than 2 to 3 at a time. And then we progress. And I think that's where we lose our patience, is when, again, like that list gets bigger and bigger. And it's another reason for mom guilt. Yeah. So be intentional about what you give. And that's probably, the fault of our health system that's incredibly broken and not having time to actually sit down and process and, passing off exercises to, techs and things like that are not educated in this. Be very intentional, but show the path forward.
Yeah.
We don't do that. Like, I don't want you to be my patient forever. Love you. Don't want to do that. Like, this is what I imagine for each session, but there's going to come a point where I want you to be able to go to the class that you like, that you went to before you had a kid, because that's where your community is. I need you to do that. I want you to be able to go out for a run and not think twice about it, or run across the playground and not think twice about your symptoms. And then I'm here for how to do your basic triage in case something comes up, but I'm here to back you up, to progress, the supportive exercises, those sorts of things. But we work together as a team. I don't want you relying on me for everything. I want to give you ownership of this problem moving forward. So it's not this thing that only I can fix. It's the stuff that we do together. And I think, again, that mindset of how we navigate these problems, it's not the mindset that we were taught as early professionals. I think that's something that, some people kind of grasp a hold of and figure out. And again, maybe that's overlay into health coaching as well.
No, absolutely. I think, honestly, it's the number one skill that every health provider needs. That's why all of the providers at the VA hospital are being required to become trained as health coaches and other more progressive integrated systems.
Yep.
It's interesting. In our country, the most progressive and integrative systems are actually the military and the VA. And they're all leading with health coaching because it's exactly what you said. Like, we can't just we've started to realize the limitations of what humans can actually execute.
Right.
I mean, that's why we're going to be getting AI. We have it, actually. Why we have AI is because we've hit the upper limit of what people can do.
Yep.
And so we now have to revisit the idea of that collaboration that you said, of what they actually want. Mm-hmm. And then be really focused on helping them get it through habit change and overcoming barriers to change. And, almost like the closet cleaning, analogy of, if you're going to add an exercise, take something else out.
No, totally. Yeah. But I think the challenges, you mentioned AI. I think the challenges that we have with some of our younger health professionals that don't realize, they're coming into working with women, pelvic health, those sorts of things at a time where we're doing so much more and we have many more research opportunities and more information all the time, is this isn't an algorithm. I think what we've lost is the ability to critically think. And that's, again, when I see those second, third opinions, these well-meaning therapists, very excited to help, all that kind of stuff, they kind of run through their list. And when that list is done and that patient is not better, they don't know what to do. And they just keep doing it instead of saying, hey, something's amiss here. I'm not understanding this or looking at this correctly. They're just like, oh, well, I guess that's just what you get.
Yeah, I think that's a huge problem in general in the health system, in the sense that there's so much to learn.
Yeah.
about it, which is actually why one of the reasons why we teach our students to focus on niche areas.
Mm-hmm.
And it's not just because of marketing, although that is somewhat important just because of everything is algorithmically driven now and will be increasingly so. But I actually also think it's important because of the skill set you begin to develop if you stay niche focused. So you're very niche focused in essentially runners, postpartum, perimenopause, and other, a little deviation to different fitness things, but that can help you deepen such a unique skill set. And this is where I think in the current state that we are now, I think we could have a whole other podcast about AI, which we will someday. But where we are today in 2024, late 2024, this is where I totally agree with you. This is where our gynecologists, our generalist physical therapists, so many providers should be referring to these deep subspecialists.
Yeah,
and that's where the role could be amazing. I mean, I have 100 stories about this, so I'm not going to get into it. But I think the bottom line is exactly right. If you're listening to this as a relatively new or generalist provider, you're probably amazing at certain things. And yet, if you have a woman who's a runner, who only leaks when she heel strikes or only leaks after, vacation and she's changed her diet or something, like this is where people like Carrie are so important to refer to because they have that deep specialist knowledge.
Yeah. No, I mean, an example I was thinking of as you were talking was I do a lot of virtual consults and telehealth now. And, I feel like that's the most underrated aspect of healthcare right now is virtual medicine. I was doing it before the pandemic. I think it made me a better therapist because I'll have clients that, they've seen 3-4 therapists in person. We have that time where I just listen to their story. I'm looking for gaps. And the problem might be I have leakage on downhills or I leak after mile 8. Well, how are you going to reproduce that in clinic? Downhills is a lot easier, but like, how are you going to reproduce that? And it's just like, with weightlifting clients, one of my very, very first powerlifting clients was a 20-something who she's like, well, my 1 rep max sumo deadlift is 330. I start leaking at 270 and I was working in a hospital-based outpatient clinic. I'm like, how do I reproduce this? The good thing was she had a lot of videos that she sent to her out-of-town coach. So we were able to look at a lot of that stuff and play and whatnot. But again, it's not my hands that fixed those scenarios. And that one in particular with, the runner who was leaking after mile 8, she just finished the women's marathon in Savannah, completely leak free, was able to do the whole thing, no problem. She's done some stroller run 5Ks with her kids. And I think we had 2 sessions. And that's again, understanding not only the pelvic floor aspects of things, but understanding what happens in running, what happened. And it's not as simple as, change your form. Like it doesn't work like that. There's not this, magic switch that you flip that's in an algorithm. It's like, let me take a look at this whole picture. Let me see what the biggest likelihood is of like, what's my hypothesis? Why do I think this is happening? And then we experiment and see what works in that scenario. And that is rewarding as all get out because because that person's gone to see 3-4 therapists in person, that they're at the end of the rope and they're really still trying and they still have hope that answer is out there. And that's, again, I to your point earlier, like, I think we need to have a lot of generalists. I'm totally fine with that, but also know when to refer out and have those resources. And again, that's what I always tell pelvic health therapists that maybe didn't have orthopedic background. Don't try and become a running expert. Please don't, because you're going to oversimplify it. You're going to screw stuff up. Like, don't, but have somebody in your back pocket that you can refer to, that you can collaborate with. And then you guys can get so much further if you don't have the time or the interest in kind of establishing that skill set further. Like, there's a way to do it, but you don't have to be everything to all people all the time. You just have to surround yourself with the resources and the people to help you accomplish that.
Well, and even someone who is a skillful generalist would know, like,
Right.
we've ruled out this and this and this. Here's what I've looked at. And they can essentially be
You'll narrow
handing
it.
the baton off
Yep.
to you with the client. I feel like that is such a collaborative model that is being used a little bit more now that we have better access to telehealth. But I think amplifying that would really start to bridge some of these really frustrating gaps for both practitioners and patients alike, for sure.
Yeah. And I mean, the social determinants of health, the primary is your zip code. That can be, displayed in a lot of different ways. And again, if there's somebody that's better at handling that, we shouldn't necessarily be limited by,
Geography.
Exactly.
Yeah. Well, thank you so much, Carrie. This has been so valuable for me, for our audience, for any woman who wants to still run and go to CrossFit and do all the things that maybe someone along her path has been like, you're a mom now. Maybe you could just stop doing that. No.
Don't. Don't. You can always start. I didn't start doing CrossFit till my youngest was 3, so it's never too late.
Absolutely right. Thank you so much. And where can people find you if they do want to refer clients or work directly with you?
Yeah. Our website is carriepagliano.com, and we make it simple. So on Instagram, Carrie Pagliano, and YouTube, Carrie Pagliano PT.
Thank you. And we'll put all those links and notes in the show notes so you can easily find her. Thank you so much.
Thanks for having me.